Forget the hard work they do and the support that they need.
Well, healthcare workers are reluctant to seek help for mental health, and this according to a study by the Healthcare Workers Care Network. It was set up in the early days of COVID-19 to provide support to healthcare workers. Let's now discuss this further with Dr. Antoinette Mirich from the South African Society of Psychiatrists. Doc, thank you so much for your time and good morning to you. I'm actually surprised that, healthcare workers believe there is, stigma in them getting help, and actually surprised that people would also equally think that, healthcare workers are almost invincible to mental health issues, struggle. Is there perception, a distorted perception, that healthcare workers are almost invincible to mental health issues?
Yes, there is. I mean, I'm surprised that you're surprised. Part of our training as healthcare workers, nurses, doctors, there is a feeling instilled that, which is, not right, that we need to be superhuman. We need to tolerate distress. We need to tolerate. I just saw your feature about the Charlotte Maxeke Hospital. We need to tolerate very difficult working systems, and without necessarily having a reflection on our own mental health. And there's a huge reluctance by healthcare workers to seek mental health care. There's a massive stigma. I think it's an internalized stigma towards ourselves having mental health conditions, and it feeds into the society stigma of towards mental health conditions.
Right. And let me tell you why the reason I say I'm surprised, because, and this is just me personally, when I think about healthcare workers having to deal with, seeing trauma patients, patients that have been, perhaps in accidents and, they're in pain, some even losing their lives, I can only wonder and imagine how they're handling all of this, because we're all human beings, irrespective of your profession. No one wants to see somebody else in pain, especially if you feel a responsibility to assist them, and perhaps you feel that you could not save them in that situation. How then has been their coping mechanisms if most of them feel that perhaps there's internalized stigma that, I don't know if they can go to seek counselling or seek help?
I mean, I do think by nature, a lot of healthcare workers, by going into the occupation, are quite resilient. And I think they rely on that resilience. There's also, I've heard from quite a lot of people, how can I fall apart when there are so many people in need? I have to keep going. And I heard this through COVID-19. And, it is quite a healthy defense mechanism when there's a crisis, when we all need to step up and help. But we are talking about once the crises have, dipped down a bit, then the healthcare workers need to reflect on their own mental health. And some of them, most of them, I would say, choose not to. They choose to deflect or deny, or they move into coping mechanisms, because where do those emotions go? They must go into unhealthy coping mechanisms, substance abuse, self-medication, just like the general population.
Right.
And there is, it really depends on the facilities these healthcare workers work in, and whether there is a supportive line manager, supportive hospital staff. The biggest reason in our survey for people not coming forward is a fear of judgment. And I can't believe we're still talking about this, that there's a fear of judgment of seeking help for a mental health care condition. They feel they will be prejudiced. And unfortunately, I have seen people prejudiced. So it's not that it's not that it's not the truth. We just need to keep talking about how it is so important for healthcare workers to seek help. You can't pour from an empty cup, and that's how I describe it to people. My whole philosophy is to treat from the top down. So if we can support one healthcare worker and get them stronger, emotionally stronger, imagine how many people in the public service they can assist.
Right, yeah.
However, if they are emotionally struggling, it's a problem for our service.
I want to talk about the risks, because we've mentioned the benefits of supporting healthcare workers, so that we almost destigmatize the notion that, healthcare workers can't, seek help. What are the risks should healthcare workers not seek the help that they need?
The risks are, I mean, they are humans, and I think we sometimes forget that. The risks are they actually at higher likelihood of developing significant mental health conditions such as like severe depression or substance abuse. And the risk is, a very big risk is burnout. I'm personally concerned, and we're seeing a bit of trends worldwide, that healthcare workers are leaving the profession. And through COVID, you know, there's been a lot of early retirements. You know, the 50 to 60-year-old group have just left medicine or healthcare. And it's a big problem because they start saying, well, I can't cope with this, and I'm going to leave. And if we could do some preventative work, perhaps we could keep these very well qualified members of staff.
Right.
And that's one of the risks. So the risk is developing a major mental condition, risk of burnout, risk of losing these healthcare professionals, either to immigration or leaving the profession.
Absolutely, good point that you're making there, Doc, and I appreciate you speaking to us this morning. Quite an important conversation to have, specifically, you know, because it's also Mental Health Awareness Month in May. So thank you so much, Dr. Antoinette Mirich, for joining me this hour.
Western Cape Judge President John Hlophe will appeal